And good morning, welcome back to the Mountain Morning Show. I'm telling you, with this director and all the commotion going on here today, I'm really happy to see that we're still on the air. That's all I can say. But we're having a lot of fun, and we have Dr. Jeff Tabin in studio with me, who is with the Moran Eye Center, but also the People's Health Clinic. And he is an ophthalmologist, and we're very happy to have him in here. And he seems like such a nice eye doctor. I think I'd be okay going to you. You know, some doctors really scare me, and some eye doctors in particular, but you seem like a pretty nice guy, Jeff.
Well, thanks. You seem like a nice woman yourself, Jen.
Yeah, you're saying that back because we're on camera. But let's talk about, you have lived all over the place. So you came here to Utah from Nepal, actually. They recruited you to come work here at the University of Utah. So what is it that you do, and how is it you ended up here in Utah working with the Moran Eye Center?
Well, I'm an ophthalmologist. I'm a specialist in all the things on the front of the eye, weird diseases on the front of the eye, corneal transplant surgery, cataract surgery, refractive surgery to get rid of glasses. And I have been working for a number of years, working to develop systems to train doctors mostly in mountainous Asia, to do cataract surgery, corneal transplant surgery, and start real full, top quality Western standard eye programs.
Which is taking you all over the place, and you're actually heading to Africa.
Well, I've been working a lot in Africa. I'll get back to that in one second. So I started out working mainly in Asia. We started a program called the Himalayan Cataract Project, which has been one of the most successful programs in developing eye care internationally. And then I was recruited to come here to the University of Utah to, do corneal transplant, cataract, LASIK, refractive surgery here in Utah, but also bring our international program to Africa, and also try to do the same system of eye care development. The University of Utah has a link with the programs that train doctors in both Ghana and Ethiopia. And we've been working also with the UN Millennium Development Villages program to see how we can bring quality eye care to the poorest places in other countries, Ethiopia, Uganda.
Well, how is that, I mean, not necessarily benefiting you, but what is it taking to send a team over to these poorest countries? Because obviously they can't pay for it.
Well, that's our system, is to try to develop how we can create sustaining systems. You know, right now, the elite of a place like Rwanda will fly to South Africa, or if they have more money, come to America for surgery.
Wow.
We're trying to capture that elite to pay, and using the paying patients to sustain the free patients. So I came to Utah to do that. We moved to Park City because it's a great place to live.
It is.
And I'm also working with the University of Utah and the Moran Eye Center to try and provide better care for the indigent population here in Utah. So we're trying to also help the poor of Utah. I live here in Park City. I see patients at the Redstone University of Utah Clinic 1 day a week. I'm there every Thursday. The rest of the time I'm down at the Moran Eye Center. But we're also I work as the ophthalmologist for the People's Health Clinic, and I'm also on staff for the new Park City Hospital.
So you're kind of all over the place.
A little bit all over the place. I'm spending about 5 months of the year, 4 to 5 months of the year, working in the developing world.
And we have actually some of these pictures we're going to show on camera right now. Tell us about some of these countries, or if you, where you're at.
This is an eye camp in Nepal, and we do the majority of people who are blind. There's 18 million people in the world who are blind, where they can't see the motion of my hand go in front of your face, Jen, from completely treatable cataracts. And it's really the biggest miracle in medicine. You know, we do cataract surgery, the next day they can see. This is a picture from Ghana, and it's lots of places in Africa you see older people who are blind being led by younger people with sticks. And it's a huge economic burden and a big impediment to development, that blind people not only can't work, but it takes another person out of the workforce to help the blind person.
Where do you see some of the most, or the many cases, you know, is compared to Ghana, Nepal? I mean, you've been so many different places.
Well, there's a huge backlog of cataracts in all of the developing world. The concentration in Nepal, when we started, there was a backlog of about 200,000 cataracts.
Oh my gosh, where do you start with a number like that?
Well, you start with one great doctor, you create a team, we create a team effort with doctors, nurses, technicians. This is a picture from Ethiopia now. But we're also, as you know, I said, in addition to working to try and develop, this is in Rwanda, this picture, and in addition to trying to develop systems to provide really high quality care in the developing world, we're also trying to provide really high quality care to our people here in Park City. And at the People's Health Clinic, they've got really good facilities for caring for people with eye disease in our indigent population.
And what's great about the People's Health Clinic is for those who are uninsured, they can find you there.
Right, and we work with a lot of the pharmaceutical companies to, one, bring down the cost of medications that people may need for glaucoma. We also provide some free medications.
What about
and I'm starting to do some of the free surgery for people who are blind here, both at the Eye Institute down in Salt Lake and also at the new IHC hospital here in Park City.
Now tell me this, I mean, I would think that most people probably don't put it as a high priority to go get their eyes checked out very often by an ophthalmologist. So what are some of the steps, or should we be going into a doctor to get our eyes checked regularly, or what are the precautions?
I think, if there's any worry of any type of disease, you should see an ophthalmologist. We have some great optometrists who check for glasses and do great wellness exams here in this area. Someone young like yourself who sees well, I really wouldn't worry about it, but it's over age 55, it's probably worth going in for a baseline check, and certainly after the age of 60, people should come in once a year.
Jeff, what is it like when you're in some of these countries, or even here, and you do a cataract surgery, and then all of a sudden someone can see? I mean, what is the reaction?
It's amazing. It's this is a lady on there, we did both of her eyes, who was totally blind for 7 years. And she's crying, seeing her child for the first time in years, seeing her grandchild for the first time ever.
That is just
really,
incredible.
It's the most dramatic thing in quite a few people around the community who have done cataract surgery on. It's really a almost painless operation, and it's one of the really great miracles in medicine.
Oh, absolutely. So people can find you at People's Health Clinic, also through the University of Utah.
And I'm at the Redstone Moran Eye Center 1 day a week.
Great.
And I'm at the People's Health Clinic every other Tuesday evening. And I'm at the Moran Eye Center the rest of the time when I'm in the country. And the website for our Himalayan Cataract Project, which is morphing into the International Division of Eye Care at the University of Utah, is www.cureblindness.org.
And we just had that on screen. So cureblindness.com is
.org.
Sorry, cureblindness.org is where you can go and you can find out all the information of what Dr. Tabin and his team are doing. But you can also visit him at the People's Health Clinic and the Redstone Moran Eye Center. Dr. Tabin, thanks for coming in. And I want to talk to you more about all your travels. This is just, I think it's incredible what you're doing. So we really appreciate you coming in.
Well, thank you. Thank you for having me.
Absolutely. Hey, we're coming back with hour 2 of the Mountain Morning Show. It's all coming up right after this.